All the data at the time suggested that people who were vaccinated, even if they got sick, couldn't transmit the virus to someone else.
All right, is that statement still correct?
Well, so we've had an evolution of science and an evolution of the virus.
Thank you, Chairman Netterholt, for holding this hearing, and to the witnesses today. Mr. Tabak, did American taxpayer dollars go toward funding the Chinese Wuhan Institute of Virology?
Yes.
All right. More specifically, was there gain-of-function research done at the Wuhan Institute of Virology which received American taxpayer dollars?
No.
No. All right. Did the COVID-19 virus originate from the Chinese Wuhan Institute of Virology?
I have no idea.
All right. What do you know about the origin? I mean, you're the NIH.
Well, again, the origins, there are two prevalent theories, a lab accident, or as you say, a lab leak, versus a zoonotic transfer from animals to humans. In my mind, the available evidence favors the latter, but of course, our minds are open to the former possibility.
It favors the latter, as in that it came
a
from...
zoonotic transfer.
So that's what you favor, just a natural transfer from what, bats to human beings?
To things like civets and such animals like that, yes.
Okay, all right. Director Walensky, in March 2021 on MSNBC, you stated that, quote, vaccinated people do not carry the virus, they don't get sick. Do you remember making that statement?
Yeah, I remember such statements. I don't know if I remember that one specifically.
Okay, was that statement correct?
At the time it was. It was a wild type virus that we had. It was even before the Alpha variant. It was the initial wild type virus, and all the data at the time suggested that people who were vaccinated, even if they got sick, couldn't transmit the virus to someone else.
All right, is that statement still correct?
Well, so we've had an evolution of science and an evolution of the virus. We have, since that wild type virus, had the Alpha variant, the Delta variant, now the Omicron variant, and numerous subvariants since. That statement is no longer correct with the Omicron subvariants we have right now.
Okay, all right. A recent review of face mask studies by the Cochrane collaboration suggests that the common face masks worn by the public probably make little or no difference. Do you believe Americans should still be wearing face masks? Yes.
Can I just comment for a minute on that Cochrane review? Cochrane
Sure.
is known as a gold standard, and I think it's notable that the editor-in-chief of the Cochrane actually said that the summary of that review was, she retracted the summary of that review and said that it was an inaccurate summary. The review of the Cochrane, which looked at randomized trials of face mask use versus not use, only had a couple of studies in it that actually were for SARS-CoV-2. Many of them were for influenza. But importantly, many of those studies, people were actually not wearing the face masks when they were in the intervention. So as I like to say, a parachute only works if it is used.
Okay, so can you answer the question?
Right now we have recommendations for face mask use based on hospital burden. We have, fortunately, 99% of places around the country, populations around the country that are not in high hospital burden, and we would not recommend face masks at a population level in those situations. All
right, Mr. Tabak. Earlier this year, the Inspector General's report found that between 2014 and 2021, the NIH did not adequately follow its policies with respect to 3 grants totaling about $8 million to EcoHealth Alliance. EcoHealth Alliance had a relationship with the Wuhan Institute of Virology in which it subawarded $600,000 to research coronaviruses in the years leading up to COVID-19 pandemic. NIH terminated the EcoHealth grant in April 2020, then later reinstated it, only to suspend it again after setting conditions for resumption that EcoHealth claimed it could not meet. NIH permanently terminated the award as of August 2022 for compliance issues, including the Wuhan Institute of Virology's failure to provide NIH with laboratory notebooks related to funded experiments. On September 21, 2022, NIH issued a new grant to EcoHealth Alliance for a project titled Analyzing the Potential for Future Bat Coronavirus Emergence in Myanmar, Laos, and Vietnam. The grant provides EcoHealth Alliance with $653,000 covering a period through August 31st, 2027. And I ask unanimous consent to submit for the record the following project details from the NIH website titled analyzing the potential for future bat coronavirus emergence in Myanmar, Laos, and Vietnam. Thank you. After NIH previously failed to ensure its policies and procedures were properly followed with respect to EcoHealth Alliance, and given the recent Inspector General report highlighting the EcoHealth Alliance failed to ensure its subawards were compliant with federal regulations, I must ask, why are we awarding this agency an additional $653,000 of taxpayer money?
We accepted all of the GAO audit findings. We have made changes to our administrative approach to ensure that these things don't repeat. We typically, once an organization has met the issues that were found deficient, we continue our relationship with them. We can't disbar an organization. Again, disbarment is done by another office within the Department of HHS.
All right, and I yield back.